Well, this sounds too good to be true, but judge for yourself because it's got doctors and patients talking. AlphaStim is a handheld device that uses electronic pulses to treat chronic pain, depression, stress, even insomnia. But as Elise Mooney reports, it's not cheap.
You don't need drugs, you don't need antidepressants, you don't need painkillers, because this will do it all.
It has been brilliant because there are no side effects and no drugs.
Pain, anxiety, stress, insomnia and depression. Imagine treating all 5 of those without drugs.
I got to the suicidal stage and I thought, I can't do this anymore.
Guy Camino was on an emotional roller coaster and a fast track to deep depression.
And medication got larger and larger because the more you take, the more you need.
Her psychiatrist, Dr. Steve Hyde, suggested she try AlphaStim, a device that uses microcurrent electrical stimulation to treat depression and pain.
If you've been on medication for so long, you tend to use it as a crutch, which I do.
Within months, she says her medication use dropped while her mood lifted.
It's a non-invasive help that is there, and take a chance with it.
I was very sceptical. It seemed a very strange way of actually treating people and getting a response. But I was curious enough to actually get a unit from the company and on a month's free trial and to test it out on a number of my patients, and then ran a small trial on 10 patients, and I was very surprised, as my patients were, by the results of that.
So surprised and so convinced, Dr. Hyde decided to sell the device himself, distributing AlphaStim throughout Tasmania and Victoria.
In 30 years I've not seen anything of this kind and the way that it works.
I see these patients coming out of their hellholes and they're actually enjoying life again. I'm not giving them drugs, I'm treating them with this.
GP Dr. Julian Henley runs a pain clinic also in Launceston. He says it's not only helped his patients living with depression, but those suffering from migraines, backache, anxiety, stress and insomnia.
It brings a tear to my eye when I witness it, and I've seen all this over and over again the last 3.5 months, and it is truly remarkable.
The tiny electric pulses encourage the production of alpha waves in the brain, which are associated with that lovely feeling of being relaxed yet alert. It also stimulates the brain to increase levels of endorphins, our natural pain-relieving chemicals, and serotonin, which is important in reducing depression and poor sleep.
You actually clip these things to your earlobes. That stimulates the release of serotonin.
Go on, stick the electrodes.
It conjures up images of Dr. Frankenstein using electrical devices to create human life.
It's alive!
But Dr. Henley assures us it simply uses a microelectric current and very low levels of electricity.
Have you ever seen the light?
Can't say I've seen the light, but I'm ready to see the light.
Let me ask you the same question in about 10 seconds.
All right.
No. Have you seen the light?
I can see the light. I can see flashing light.
Okay, so you've seen the light. Now that is how quick this device works.
Okay, I don't necessarily feel better.
Look, if you had a migraine, it might have gone just like that.
A $600 device is used to treat mood and depression. A $1,100 one is used directly on parts of the body to ease pain. Dr. Henley's patients claim it's worth it.
What did you try in terms of cures? Pain relief?
I've done everything from having surgery, from being microwave nerve endings, to have people with crystals enchanting over me, acupuncture, chiro, physio, and morphine.
Andrew Yedder says after using the device for 2 months, his back pain has gone.
It's brilliant. It's a lot cheaper than giving someone chemicals.
I had extensive carpal tunnel problems for almost 8 years and had an operation on one hand that took over 2 hours. The left hand needed to be done, been on the waiting list for the last 5-6 months.
Lisa Isle says she's cancelled her operation after 4 sessions with the device.
The other day, for the first time, cooked a full meal from scratch. Was able to mash the potatoes. That was my problem.
We medicos are fairly conservative. We don't really change our approach to things. We need to see a lot of evidence before that happens. So I think there's been some natural resistance to new treatments there. But about 10 million Americans have used the device, and it's spread worldwide now.
The technology is not even new. In fact, microcurrents have been used for about 40 years. Now, independent pain management experts say this device should never replace antidepressants or other pain management drugs, but the two can be used in combination.
This may provide an extra dimension that might help you either to lower your dose of medication or even potentially ultimately come off some of your medication. It would be almost unethical to advise that they should try this just so they can come off their medication. So no, I would never do that.
Dr Len Rose from Melbourne's Metropolitan Medical Centre has been using this technology for 15 years. He says there is a place for this treatment, but considers it expensive.
You could get a lot of therapy for the price that you're being asked to pay for this machine. And certainly therapy's got a much greater body of evidence for it. There are other machines which are cheaper and which do the same type of thing.
But what about side effects with something like this?
Oh, look, a lot of people who try this treatment will feel slightly out of it for the first few seconds, sometimes quite nauseated, they'll feel dizzy.
For some, like Di's husband Gary, there doesn't seem to be any benefits.
It was not successful with my back problems at all.
So it's not for everyone?
No, I'd say not for everyone. I'd say it's a matter of trying it and see if it does suit you.
But for Di, it's been life-changing.
This has helped me come out of a fog that I've been in for years.
It's hard to believe, isn't it? But if you're in pain, I guess you'll try anything. Of course, if you are suffering from any of those conditions, your first priority should be a visit to your local GP. You'll also find more information at our 9MSN website.